Good morning, good morning, good morning to everybody who is logging on to the Black Health Hour hosted by Khan. Thank you so much for being here I mean, it's bright, but I suppose it's not so warm, November morning. For those of you who don't know me, my name is Dr. Ayo Olatoye. I am a consultant in acute medicine as a hobby, but I'm also, a father. I don't know whether you've realized, but I'm a man. Today's, November. It's November. It's Men's Mental Health Awareness. So we're ready for a great session. Now, before we go on, one of the things we were talking about before we pressed play is that sometimes engagement when it talks about men's health is low. So what I want you to do, you right now, is send this link to somebody else. And if you're listening on YouTube, when you watch it, send it to somebody else because men, we need to engage, we need to have these kinds of conversations. We need to make sure that um, things are moving forward. Now, you might have seen my hands and wondered and why is he in his car? Why has he got paint on his hands? I was telling everybody before. A friend of mine called me and said, I need some help and he's renovating his house. He needs help painting. So I said, yeah, I'll be there. Just have to do this Can't Health Hour. So that's what I've been doing this morning. I brought my son, and then we've been helping him out. Why am I making that point? Because one of the things I'm sure our learned colleague might talk about is that men specifically, sometimes we have difficulty talking about when we need help. And when a man tells you I need help, I think it's important for us to listen because it's taken a lot for that man to ask. So I wanted to be receptive to my friend, a very good friend I've known for a long time. He asked me for help, so I'm there. So please let's be attentive, let's listen. We're going to hear a lot about men's health today. I'm sure it's going to be a tour de force, and it's going to give us very many points that we can use in our life as men to take care of ourselves better, and people, the women in our lives, to help us, and see how they can help with regards to men's health. So without further ado, I want to introduce our speaker this morning. His name is Dr. Olufemi Bewaji. He is a man. I don't know whether you realize that. He's a man. He is an aspiring New York Times best-selling author. Look out for his books. He is a husband. He's a father of three. And again, as a hobby, he's a GP working in Doncaster. And he's going to give us a talk today about men's health. Dr. Olufemi Bewaji, thank you so much for your time. Please take it away. We are all ears.
All right. Thank you very much, Dr. Ayo, and good morning, everyone. I hope I'm very audible. We can all hear me very well. All right. Thank you. And thank you very much for that introduction. It's quite yeah, it's amazing. Hearing that I'm just doing GP as a hobby. And I think I like that because many times, you tend to think that you tend to look outside or you tend to get boxed in, yeah, by medicine and lose some of those other things that you'd like to do. But definitely, I hope one day I'll put up a few things, books and all that, and then we can all get to read. Yeah, so let's just cut to the chase this morning. We're talking something very important, and that's men's health. I'll be sharing my screen. Please do let me know if and when hopefully I'll be able to sorry, just a minute. I'll be sharing my screen now and yeah. Okay, yeah, thank you. So, sorry, I don't know how long I have for this presentation, although I don't intend to keep us for too long. So maybe about 20, 25 minutes, and then we can have a session of questions and all that. Yeah, thank you once again, Dr. Ayo. Thank you, everyone. It's such a pleasure for me to be here this morning talking about men's health. And when I was told that I would have this privilege, I didn't take it for granted at all. And I went all out to make sure that I pass across the information I believe we all need at such a time as this. So the theme is Movember, and Mo is from, of course, from Moustache. And is talking about men's health generally. Um, okay, I'll just go on to the first slide. And the only disclosure I have here, conflict of interest, is that I'm a man. And I tend to have a bias for men's health, actually. Of course, we've heard Dr. Olatoye also say that several times this morning that, yeah, definitely I'm a man. And yeah, my bias is towards men's health. I live with women, so I tend to also have a bias for that as well. But generally, I'm passionate about seeing men live better and live longer. Now, just to start off on a bit of a lighter foot, um, a lot of problems start with men generally. When we talk about mental health issues, it begins with men. There's a problem a lot of people have with their knees, and that's when they have meniscus injuries. It also begins with men. Meningitis, a problem with the brain starts with men. Um, Even things like there's a condition called men, actually. It's a kind of cancer that some people have that begins with men, multiple endocrine neoplasia. So many things start with men. Even women problems begins with men. Menopause, menstrual cramps, menstrual irregularities starts with men. But I like to say that men are not a menace. And that's why we are talking about this morning and having a chat about what we can do to improve men's health specifically. Yeah, so the first, the elephant in the room that we need to address this morning is the fact that men generally tend to live less long than women. Women generally live longer than men globally, all over the world. And a lot of factors have been attributed to that. And we've heard Dr. Ayo say this morning that if a man should tell you that they need help, then we need to pay attention to that. In the UK, for instance, life expectancy at birth for men is 79 years, for women is approximately 83 years. That's a whopping 5-year gap. Now, there's something called healthy life expectancy. That is, if someone lives for 79 years, a man, for instance, lives for 79 years, out of this number of years, the healthy life expectancy factors into it the quality of life as well. So it's expected that 61.5 out of those years will be lived in health, quote unquote. And for women, 61.9 years will be lived in health. So many studies around the world have shown that women consistently outlive men. And bringing this home to our communities, given the greater burden of risk factors like hypertension, like diabetes, like cardiovascular illnesses, like certain types of cancers as well, that is more common and more frequent among African and Caribbean men. These statistics matters even a lot more. And that's one of the reasons we are gathered this morning to talk about this, to have this chat on this very important Movember month. Now, I'll just do a quick overview of this chart once again. And that's, of course, we've talked about the global stats with respect to life expectancy. That's the hard truth. Global stats says that men 70.9, women 76.2, and that's a gap of 5.3 years. And of course, we've talked about the UK stats as well. And one interesting fact I also found out is the oldest living person per continent, all of them are women, except for one continent, I think. I'm not very sure about the fact, but I think for almost all the continents, most of the oldest living, they are called super centenarians. That is people that have lived up to 110 years and above. All of them are women, maybe except for one continent. All of them are women. So that's one thing that we need to also consider. And why the gap? I'm sure in the UK, for those of us that travel by train, we often hear that saying that mind the gap between the platform and the edges and things like that. So why this gap? Why this gap? A lot of factors can be attributed to this discrepancy between life expectancy for men and for women. Now, one of such factors is the fact that men are 3 times more likely to die by suicide or whatever, for many reasons, actually. For many reasons. Like Dr. Ayo said at the beginning, men hardly would hardly show that emotional struggle. I'm sure someone's going to talk about mental health next week, I believe. But I'm not going to dwell so much on that. So men are 3 times more likely to die by suicide. Um, and there is higher rate of substance abuse, cardiovascular disease, late stage presentation of certain kinds of cancer in men as well. And then there's the cultural reluctance to seek help. And that's what the host has said this morning. Cultural reluctance to seek help. Men just believe in that, there's that savior complex that we often find ourselves in, that, okay, we want to be there for everyone and we don't want to show weakness, so to say. We don't want to show that, we want to toughen it out. We want to just face it head on, which is not helping many men. So that savior complex is there as well. I used to work in emergency medicine back home in Nigeria then. And usually we used to say, we had the saying then that if you see a man come to the emergency, then it's usually likely to be an emergency. Because most times they'll just sit back at home and try to just toughen it out and wait for the very, very late stages before presenting. Now, we've talked about the fact that the higher risk of chronic diseases, heart stroke, diabetes amongst men, higher rates of risky behavior as well, smoking, substance abuse, alcohol, excessive alcohol intake, and sexual incontinence, whatever it is you want to call that. Sometimes, yeah, men are more likely to indulge in such risky health behaviors. Of course, we've talked about reluctance to seek help earlier as well. Now, yeah, I may not ask us to, but just a quick question for all of us, and that's who amongst us knows their blood pressure, or if we want to be a bit more lenient, who has checked their blood pressure in the last 6 months? I won't say we should raise our hands, but that's just food for thought. And then when was the last time you had a health check? In the UK, we have a system that someone is raising her hand. Yeah, that's very good. It's very good for, but the person raising her hand, I believe, is a woman. So now, who, yeah, so many of these things are very important. These are things we need to talk about. Now, talking about blood pressure, for instance, I'm sure we'll still get to all that in the course of this presentation. Talking about blood pressure, we used to call it a silent killer. When you see many people, they'll tell you that, oh, I've been feeling fine, I'm all right, I'm good, I have no symptoms. But the truth is, once blood pressure begins to give you symptoms, then you know that there's a problem. There's a big problem, actually. There's something we call end organ damage. When you begin to have symptoms and when we begin to notice certain things, when blood pressure begins to talk, then that means there's trouble. There's trouble already. So we don't want it to get to that point. It's very important for us to check some of these things regularly. We have a health system that works in the UK, works well, that you can take advantage of and have these numbers checked. Now, so to the crux of this whole presentation, when we talk about men's health, we want to be sure that we are taking it from the nitty-gritty, from the very beginning. We want to be sure that we've put things right from childhood even to all the way to adulthood. So we encourage the notion that lifelong health starts in youth or early adulthood. And we begin to talk about things like vaccinations that are relevant to boys and men. Mumps vaccination, for instance, is offered to children. It is very relevant because there's something we call mumps orchitis. Now, don't bother about the big words. I will explain. That's when mumps affects the male organ, the male testis, and it can be a cause of infertility. So such vaccinations are important to prevent these kind of things from occurring in future. And then there's a particular vaccination that we've heard prevents cervical cancer, and that's the HPV vaccination, which is offered to women. But a lot of people think it's for women alone, but it's offered to boys between the age of 12 and 13 years in the UK, and is relevant in preventing certain kinds of cancers, genital, throat, anal cancer, in men as well. So those things are very important, starting from the preventive measures that we need to put in place. Then, of course, like I said, HPV has been linked to penile anal throat cancers in men because, of course, certain sexual practices can predispose to that. Vaccination isn't just for girls. They protect boys too. Now, there's this slide I've titled "Be Okay" in the UK, and that's because there's a lot of facilities available that we can engage in, and which I believe is we should to help uh, to help improve our health generally. Now, there's the GP you can see for dental cases. You can go to your dentist. There's A&E for the yeah, that you can access A&E for more serious cases, so to say. NHS 111 is there, 999. You can call for emergencies. And then, of course, there's something we call the 2-week wave pathway, where we refer for suspected cancers. Now, I've done a bit of red flag symptoms that should not be ignored, whether you are a man or a woman. Red flag symptoms. And I'll just quickly run through many of these symptoms. One is unintentional weight loss for whatever reason. Well, some people, is the fad nowadays want to lose weight, want to shed some weight. But if you notice that you are losing weight, you didn't try, you're just losing weight, then it needs to be checked. It may be something serious, maybe something maybe not too serious. Chest pain, shortness of breath, very, very important, very important. That should not be ignored. Of course, I don't want to talk about the various characteristics of certain chest pain that some people can have that we consider to be serious. But any sort of chest pain should be investigated. I see people come to the GP with chest pain, and I tell them that this is not something for the GP to manage. I'll prefer you to go to the hospital, get your ECG, get your bloods, and then if they said there's nothing wrong, then you can come back and maybe we can refer you to a chest pain clinic and things like that. But we've lost people because they had chest pain that they ignored. We've had people like that. Chest pain, shortness of breath can be many things, and many of them are quite sinister things. And then bleeding maybe from the back passage or from the front passage, postmenopausal bleeding in women. We're not talking about women today, but bleeding from anywhere is very important. Then sudden severe headache, sometimes described as the worst headache of your life. Sudden severe headache that comes, or headache that persists, that doesn't just go away. It's just there. And it's different from the usual headache that you may have after because of tiredness and things like that. And then severe abdominal pains, sudden onset of abdominal pain that just comes like that. Then there's this stroke symptoms that we talk about, the fast symptoms, facial drooping, arm weakness, slurred speech, and then the T's for time. Yeah. If those symptoms come, you need to. Persistent fever is another thing. Lumps or swellings anywhere. For a man, where can we have lumps? Maybe testicles, maybe abdomen. If you notice anything strange or a rapidly growing lump, very important to get it checked. Very important. On your skin, even in your mouth, your throat, anything like that. Then difficulty or painful swallowing, very important to get it checked. And then persistent hoarseness of voice. Persistent hoarseness of voice is also important to get that checked. There may be a few other ones, but these are the main ones we typically would want you to get checked. Now, there are some gender-specific red flags for men. We've talked about some of these, like testicular lumps. Important. I still saw a case of testicular cancer recently in a gentleman, about 30-something years old. Now, when I examined the testicles, I knew that, oh, something was wrong. Something was definitely wrong. But of course, we needed to send off for ultrasound, and it came back. And I knew that probably had been going on for quite a while because the testicle, almost the whole testicle, felt very hard to touch. Yeah, we got the diagnosis. It was testicular cancer, metastasized already to the lymph nodes. So those things, and it's a good thing that you can actually do a self-testicular examination. Most men do it when they're in the shower. They just check and look for lumps, look for things. Another thing is sudden onset of erectile dysfunction is something that needs to be checked. It could be cardiovascular cause. It could be endocrinology from one of those things. Could be one of those things as well. Then lower urinary symptoms, frequency, urgency. Frequency means you just keep going. someone says, I've gone to the toilet now, and in 5 minutes you feel like you need to go again, or if you have burning when you pass a wee, stinging, things like that, blood in your urine. We've talked about that already. It needs to be checked urgently, urgently. It's a 2 week wait referral to the specialist. Um, yeah, so there are certain sort of health screening that is available to men in the UK. Yeah, we all know about the bowel cancer screening for men and women starting from age 50 in the UK. It's available all over. And of course, a lot of people will get the kit posted to sent to them by post in the UK. Then there's something that is done for men age 65 in the UK, and that's screening for abdominal aortic aneurysm. That's there's a big blood vessel in the tummy that passes through the tummy, and it's called the aorta. It's a big sends blood to every part of the body. It's when it balloons out, when it begins to swell, then that's it's a problem because it can burst and it's life threatening. It's life threatening. So for men, typically they get a scan at the age of 65, and so that's one of the things we can also take advantage of. Other routine checks like blood pressure, cholesterol, for HbA1c is the check for diabetes. Then of course, BMI, waist circumference. We need to check our weight as well. Now, there's something about the prostate. I see a lot of men just come because they've seen an advert on the TV and they want to get their prostate checked. They want to get a PSA blood, but there's no screening that has been ratified in the UK for checking for prostate cancer, and that's because many of these tests are still not fail safe. For instance, you can do a PSA test and it's high, and there's really nothing going on. Maybe for some other because it can go on, it can become high for certain other reasons, and you can also do a PSA and it's normal, and there's something going on. So that's why we typically would advocate that even if you want to get a PSA done, also get a physical prostate check. Unfortunately, unlike the testicle that you can test yourself, I don't think any man can check their prostate by themselves. So you need to get it done by maybe your doctor, maybe your GP. I remember back in medical school, they used to tell us that pair yourself so they can check your prostate. But I don't think anybody did that really. So PSA, a lot of people will just come because they've seen an advert on the TV. They had a friend that had prostate cancer and they want to get it checked. Yeah, we can do it for them, but it doesn't mean that they've not got anything going on. So usually we still rely on symptoms that we've talked about, the lower urinary tract symptoms of frequency, of urgency, of dysuria, of blood in your urine. And then we rely on a physical check as well. And then we can add on to that the prostate check just to be sure there's nothing going on. And then it's also very important to know your numbers. Know your numbers in terms of blood pressure, cholesterol, sugar, weight, because when cholesterol goes up, it increases the risks of cardiovascular events eventually. Okay, just a quick one about prostate cancer and testicular cancer. Prostate cancer is said to be the most common cancer in men in the UK. And men of Black ethnicity, like African Caribbean origin, have a much higher risk, around 1 in 4 lifetime risk compared to, I'm sure we've seen the advert everywhere. The general population is a 1 in 8 chance, but for men of Black or Caribbean origin, it's a 1 in 4 chance, lifetime risk of prostate cancer. And that's why it becomes even more germane for us to talk about this in our community. Because many times, yeah, I've realized that most people of African or Black origin do not really, want to have this sort of discussion about cancers, about this sort of things for various reasons. It could be cultural, it could be religious. We don't want to have that kind of discussion. Unlike the Caucasians, they talk about it freely. They want to get it checked. They're sometimes even glad that it's picked up early because they know they have a chance and things like that. So So there's higher rates of late diagnosis in Black men, obviously because of some of these reasons we've talked about already. And then the risk of this increases from age 45 onwards. So early detection saves lives. And then for testicular cancer happens in younger men, maybe 20 to 45. The patient I talked about earlier was in his 30s, I think. And he was even going on holiday to Turkey. When I got back the report of the ultrasound, I had to call him in Turkey. He was in Turkey. And look, young man, you need to come back. We have referred you to urology and all that. So testicular cancer is commoner in the younger age group, and is highly treatable as well if caught early. So we encourage self-examination of the testicles from time to time, um, and to seek help if anything. Like I said before, you can examine the testicles, but you may not be able to examine the prostate yourself. Um, so we encourage men, if you notice things like urinary symptoms that we've talked about, testicular lumps, pain, unexpected weight loss, and all that we've talked about earlier, see your GP very early. This is just a pictogram showing these various sort of health checks that are available in the UK, whether for men or for women. Um, so it talks about, okay, I've talked about this before, the GP, the A&E, the 2-week wait pathway. Yeah, there's something UK does, and that's for men above 40 and above health check. They do all the bloods, including full blood count, use an lipids profile to see if there's anything. Then routine checks like blood pressure, your weight, BMI. Of course, I've just put a picture out for both sexes, for men and women. So for both gender, yeah. So cervical smear for women, mammogram, men don't do mammogram. Interestingly, I think, of course, men also have the risk for breast cancer as well. I think it's about 1 in 100 chance, or I've seen one in my practice, one breast cancer in men. Then bowel cancer screening, like we've talked about, aortic abdominal aneurysm that we've talked about as well. And then symptom-based tests like colonoscopy, bleeding from the back passage, you may need to be followed up by a colonoscopy. That's just a camera test from the back passage. Symptom-based, because I've had a young man that died from colon cancer at the age of 20 something. We were colleagues just after house job. He just started to have symptoms then. And it was found that he had a tumor in his colon, and very brilliant young man. And eventually we lost him. So some of these things are because there's likely to be a very high family history of some of these medical conditions. And that's why at such a young age, he got that and eventually lost his life. And then PSA, like we've talked about. So family history consideration needs to be put into consideration as well. So one very important thing that we also need to talk about is what I've titled lifestyle seeds. Many times, prevention is better and infinitely cheaper than cure. So when we talk about lifestyle seeds, SEEDs, I've just done an acronym like that, as for smoking, exercise, excessive alcohol, diet, and stress management. So I'll just quickly talk about these lifestyle seeds. Number one is smoking. Smoking in all ramification, whether as an active smoker or a passive smoker, is very, very detrimental, is deleterious to anybody's health. I used to make this joke that when I was in medical school and they asked us what are the risk factors for this cancer, I'll just put smoking because I know smoking will be there. Smoking has to be there. So smoking is one risk factor. It's a modifiable risk factor that you can avoid. You can avoid smoking. Yeah, if you do smoke, I think it's just very important to avoid it. I'll just give a few statistics. It says smoking reduces life expectancy by about 10 years. And I think 10 years is quite a lot. It reduces life expectancy by about 10 years, and it's responsible for many cancers. Just name them. It's a risk factor in many cancers. Just name all the cancers you can. Smoking is likely to be a risk factor in many of them. It says here that 74,600 deaths in the UK is attributable to smoking-related causes. of adults 35 years and above. And of course, we've heard about COPD. I've seen patients that have had to live on oxygen, home oxygen, for the rest of their lives, apparently because they have end-stage COPD and things like that. So it's very important to avoid things and smoking. Um, the other thing is exercise. So sedentary lifestyle. I'll just read a few statistics here as well. Research shows that people who sit more than 8 hours a day with no physical activity have a risk of dying similar to those posed by obesity and smoking. So there was an article I read a while ago that sedentary lifestyle is the new smoking. So if you are not active, or if you work at a job that is not very active, then you need to create avenues for you to move around. You can register in a gym. A lot of people do gym registration, but they never go. So it's important. You can if it's jogging, if it's walking, brisk walking, there's a certain level of activity that is expected in a week, and it's something that it's free. Yeah, it's free for you to do. So exercise is very important. Now, the thing is excessive alcohol. The recommended UK standard for limit for alcohol limit for men and women in a week is 14 units per week. Of course, there's always that argument that for me, I'm a teetotaler. I don't drink alcohol. I just abstain totally because where do you now draw the line? I've seen too many sorry tales of people that have been overtaken by alcohol, that have become alcoholics and need help. I remember seeing a young man in his was it 20s or early 30s, I think, and he's got two kids. He was visibly shaking when it came he was withdrawing from alcohol when it came. He had a seizure and he had that willpower to just let go, but alcohol had gotten the best of him, and he had taken over his life. And I asked him a simple question that, what is your motivation for wanting to kick this habit? And he said something very profound. He says his son, who is about 4 years old, is watching him grow. Or is growing watching him like this, and he doesn't want to set that kind of example for his son. So yeah, we did all we can to help him, but it was just a sorry case. So that's the point. Where do we draw the line? If we have the argument about okay, excess, no excess, and things like that, but recommended limit in the UK is 14 units. Alcohol misuse has been linked to a wide range of conditions like high blood pressure, like stroke, liver disease, cancers, and all that. So drink responsibly if you have to. If you can, then abstain from it. The other thing is poor diet, and yeah, we always advocate a balanced diet. There's always that tendency. You've worked very, very hard, you are busy, to just grab a bite somewhere, go to one of those fast food restaurants. I won't mention anyone. Just eat some. Every one of us, once in a while, we are prone to that. But it's very important to have a balanced diet, and balance in the sense that it contains in the right proportion all the necessary nutrients for growth and yeah to live healthy. Um, yeah, it's not just about eating less junk, but to eat more of the protective foods, so to say, the whole grains, the vegetables, the nuts, and reduce salt, no added salt, and reduce processed food as well. Stress management. Stress management is very important. We tend to want to put a lot on ourselves more than we can bear. But the truth is that there's always a time to say to just let go. Book your vacations, go on vacations, distress, live life to the fullest. Um, if you think that you are overwhelmed, then it's always important to just talk to someone or to just say something about it. Give someone a heads up that look, things are getting challenging. I know someone's going to talk about mental health next week, but it's always very important because men, many times, for whatever reason, cultural, personal, and things like that, tend to bottle things in. Just keep going, just keep going, just keep going until it becomes too much to handle. So stress has been linked to many things as well: high blood pressure, cardiovascular problems, mental health issues, especially. So it's very important. And like we said at the beginning, men are 3 times more likely to commit suicide than women. So oh, so it's very important to manage stress as much as possible. All right, so that's the lifestyle seeds. Smoking, avoid smoking if you can. Exercise as much as you can, and within, of course, within the limits of what you can tolerate as well. But whatever it is, just keep moving. It's always very important. Avoid excessive alcohol intake. Then diet. Diet should be taken into consideration as well, and stress management. Yeah. Okay, I think this is going to be my last slide. Like I said at the beginning, I'm someone that likes creative writing. I like um, to put things, to write poems and things like that. So that's one of such things I've written about men's health today. And it says that men's health is not just about statistics, it's about stories. Because behind every number is a name. Behind every diagnosis is a dad, a brother, a son, a friend. Many times we just quote the statistics and say that this so percentage of people have died by cancer. But to many people, it's more than just statistics, it's more than just numbers. It's a relation, it's a friend, it's someone that's close to them. Too many men are fighting silent battles with their bodies, with their minds, and with the weight of expectations. But silence in this instance has never saved a life. So, but a conversation can, community can, and care can. Movember is more than mustaches, it's a movement. A movement to remind us that men matter. Because when men rise, families rise. And when men heal, communities heal. And when men start to talk, then men start to live. Thank you very much.
Thank you so much, Dr. Femi. That was wonderful. That was inspiring. That was informative. And it's given us so much food for thought. Thank you so much for your time and obviously your experiences and your openness and transparency in sharing some of the things that you've gone through. So just personally, it was very good to listen to, and I can see that you're very passionate about it. So thank you for your time. So whilst everybody's thinking, I want to encourage you to use all the platforms to ask questions. Send the questions to us so that we can pose them to Dr. Femi, so that we can pick his very big brains. So.
Don't worry. Thank God you are here as well. So whatever question I can answer, I'm sure you can answer.
So, I mean, I'll start off with a question. So, you mentioned obviously you're a GP and you're passionate about men's health, and I think it was very poignant what you said about when you're working in A&E in Nigeria that when a man comes in, actually, it really is an emergency. Um, uh, can you think of anything like specifically that is a big contributor to why men may not want to um engage?
Well, I think from experience, from what we've talked about, many times I really think that that savior complex is a big issue. Really, you think you need to be there for everyone. You are the macho man. You are the one that needs to take care of everyone else,
Mm,
but yet your own health is failing as well.
mm,
And then many times, maybe that feeling that, well, this chest pain, well, I can just deal with it somehow. I can just go on and continue doing my thing. Checking your blood pressure, well, I feel all right. Most men just keep, maybe in the pecking order of things, they just feel that some things are more important. Let me take care of my family. But
yeah,
the important thing I tell them is this family you want to take care of, if suddenly something happens to you, all of a sudden, then who is left to take care of them?
yeah,
So I
exactly.
think that if you begin to view things from that perspective,
Hmm.
then you begin to look after yourself a lot more than
Absolutely.
you're actually doing. So I think the savior complex is there. The
Mm,
fact that, of course, you need to make ends meet. Yeah,
mm,
maybe that's one thing that many men are just all over the place. They just want to do one thing or the other just to make
yeah,
sure that the children don't suffer, the family doesn't suffer. You want to just make
Yeah,
sure,
exactly.
and all of a
Mm.
sudden something happens, and that's it.
Mm.
So, but if we look at it from that perspective, that taking care of your health is actually also taking care of your family. You are
Yes.
loving your family. Many men have
Mm.
died, and then the family just left in penury, and
Yeah.
something just happens because you are the breadwinner. Just yeah. So I think if you look at it from that perspective, that taking care of your health, taking care of your family, taking care of your loved ones as well, then I think many men will actually pay heed and
Yeah.
take more
The
counsel.
questions are coming in thick and fast now. So, quite
All right.
from the social media platforms, as the main provider for my family, the pressure is constant. How
Hmm.
can I manage this anxiety without feeling like I'm failing them?
Hmm. Yeah, well, like we've talked about already, it's something that every man faces. The pressure
Mm.
is constant. The pressure is constant. The burden of expectation is also there. But like I
Mm.
said, if you look at it from the perspective that, okay, you need to slow down a bit as well, look after yourself, not take time off. It was when I got to the UK that I realized that skipping your holidays and all that is not something that they applaud here. In Nigeria, I can say, oh, you're not going to your leave. You want to work and take care of your department. But
Yeah.
here, it's not something they appreciate. Everybody has their holiday booked ahead, well ahead. They are
Yep.
taking care of themselves. So I think it's something we can also embrace
Yeah.
as a community.
Absolutely.
Um, it doesn't make you it make you look weak. It doesn't make you look negligent if you take care of yourself. If you
Yeah.
think of yourself first, because in doing so, you're actually being proactive, you're actually being very considerate and looking after your family as well. So I think one way to look at it is that looking after yourself, you are looking after the future of your family,
Mm.
making sure that nothing happens to you and whatever it is you are trying to avoid, whatever it is you're chasing, then it actually happens eventually. If anything happens to you, if you lose your life, then like I
Absolutely.
tell people, work goes on. If life is lost, work goes on, and maybe after a few days, few months, everybody forgets and life moves on. So it's very important to take care of your health. And I think
Mm.
having that mental shift is what is really needed now.
I mean, I would say to that man, I think just like Dr. Femi said, this is something that everybody deals with. And I think one of the lies in society that makes it difficult for us is to think that I'm going through this alone. It's a lie. It's a lie. You're not the only person who's feeling it. And it feels hard because it is hard to be a breadwinner, if you're married, if you're a father. Now the because men as boys were not taught to, deal with difficult emotions, the anxiety that you feel feels unfamiliar. And I would just say to whoever's asked that question, I think thank you for your openness and transparency. But I think be honest. One of the things that I have experienced is um I was listening to this podcast the other day. We talked about Superman contest, Superman complex. Lois Lane fell in love with Clark Kent, not with Superman. And when I have been honest with my wife about what I'm dealing with, or with my children about what I'm dealing with, it gives them, especially my son, permission to deal with his difficult emotions. And imagine what it would have been like to grow up to your 30s and 40s and be able to be honest. I'm struggling with this. I feel sad. I feel this and that. So I think that your family, you would be surprised that the world won't end, when you are honest about something that you're struggling with. And I'm sure Dr. Femi will attest that there are a lot of men who, because they've built it up and they need a release, they can engage in things that are unproductive to deal with the pressure that you feel. Whereas if you can learn to, so journaling, talking, expressing, talking to your friends, that puts you in a position to like a release pressure valve and reduces the chance that you're going to do something that you may regret, later. Another question I have for you, Dr. Femi. I honestly don't know how to ask for help. Family is far, and I don't have a close circle of friends. How would you help this man?
Thank you for that question. And I think I quite 100% agree with what Dr. Ayo has said about being open. Being open is very important. Now, if you don't know how to ask for help, there are a lot of avenues that are available, to be honest, in the UK. There's something called, I don't know if you're religious, your church, you can discuss with someone that you consider maybe a spiritual authority. There's something called Andy Men's Club as well. In the UK, you can Google. I think it's available in every locality, and you can talk to someone. They are trained um, therapists, specialists that you can speak to. There are also talking therapies that are available almost everywhere in the UK. That you can give them a call, they will speak to you over the phone, they can arrange a face-to-face. But it is very, very important. Whatever it is you do, make sure you speak to someone. Speak to someone that can help. Speak to someone that can, don't just bottle in the emotions. Sometimes just letting it loose, just talking alone takes away maybe half of the burden. Just speak to someone, and there are avenues available. Andy Man's Club, talking therapies, online things. Just talk to just speak to them. And I'm sure I don't know if there are counselors available in this group as well, in this community that you can speak to as well. Maybe someone can reach out to you, or you can reach out to someone in this community, and they'll be able to get you somewhere. But I think it is very important to talk. Yeah.
Absolutely. Absolutely. I think again, this is one of those there's a people I follow online, and there's a gentleman called Jason Wilson. I would encourage everybody to Google Jason Wilson, and especially if you're a
Jason
man.
Wilson. Okay.
One of the things he talks about is this misleading mantras that men say, or that society has said to men, that mislead them. One of them is, big boys don't cry,
Yeah.
no pain, no gain, all these kinds of stuff. And this thing about, oh, I'm alone, I can't ask for help. All of that stuff is a lie. It's a thing of conditioning, that puts you in a position where you're isolated. For those of you who understand scripture, the Bible says of the devil, and he is like a roaring lion, seeing who we can devour. Now, the thing that if you look at the image, lions don't ever attack the herd. They roar to scare the herd so that they can pick off the ones that are isolated. So isolation is detrimental and community is protective. So just like Dr. Femi said, whether it's, somebody because I know that in my life, the people that I am closest to are the people that I have allowed myself to be vulnerable with. And maybe it is scary the first time when you share something that you're not sure how it will be received. But as you continue to do that, you develop better friendships. So please don't be scared to do that. And even if there really is nobody, there are professional organizations that you can engage with. And I would also say one of the things that I love about Khan is that we encourage people, this is your life. This is your life. So maybe the GP can't help you or this and that, but there are lots of private therapy or talking therapies that you can engage for yourself. I've paid for, talking therapy myself for my family when my dad died, because we wanted to make sure that our kids had the vocabulary to deal with that sort of thing, because I was unwell, and so I'm saying that don't believe the lie that there's nobody. No, there are people. The thing to do is let's go and find them. So another comment here, knowing that men are unlikely to look after their health, and then women need to stand in the gap for them and drag them, not physically, to get the necessary annual MOT. So I suppose a question for you, Dr. Femi, is speak to the women in the lives of the men. How would you encourage them to encourage their husbands, fathers, brothers to engage?
Thank you very much. I think that's something very important. I've seen too many men that come to the practice, and they say point blank that they only came because of their wives. So I think the women in our lives have a role to play as well. And when when
Please.
when you have this information at the tip of your fingers, you can tell
Okay,
them
so
about
turn
it.
right.
Yeah, so tell them not to
Quick.
Sorry, carry on, Dr.
All right. So it's very important. I think sometimes some of the men just need that extra push to be able to do what they ought to do, not to ignore symptoms, not to take things for granted. Because men generally, I think we are just a bit more, not even a bit. We are wired differently from women. We
Yep.
tend to ignore things. We tend to just push things to the back burners. Women will notice things. There are certain things that happen in my house. I come to the house, I don't even notice things have changed. But my wife, once she comes in like this, she notices that who put this here, who put this here, who put this. So women are just a bit, they're just wired differently from us. So they notice when things change, they pick things very fast. And I think we can use that to our advantage. If you have brothers, you have husbands, you have people in your life that, of course, you care about. Let's give them this information and tell them that this is what is available, that you can access this, you can do this. If you have this, you can do this. If you think they are struggling mentally as well, you can tell them about available opportunities that they can harness in the NHS and outside of the NHS, available
Yes.
everywhere. So I think the women actually have a role to play, to be very
Absolutely.
honest, just because we are wired differently.
Yes.
What we may think is not important is important to you. It's
Yes.
important to you, and then you pick things very fast, and then you can make men, and many women have a way of making men do things. Yeah, just
Yeah.
just let them, yeah, give them the necessary push they need at times,
Yeah.
and then
But
get them to do
yeah.
it.
I would also add that, not to be controversial, that, as a man, I want my wife to be my wife and not my mother. So sometimes
Yeah,
sometimes
so yeah,
no,
definitely.
please, no, Gary, so sometimes, you know, we have to be mindful that, like I said at the beginning, for a man to recognize so, and general, I know that we're generalizing here. Some men are, different from an emotional awareness point of view, but
Oh,
but
yeah.
generally for a man to articulate a problem or a need, there's been a lot of things that happen in the background. So when you recognize that a man is being open or honest or transparent or vulnerable, we need to make sure that we respect that, and don't use that later to throw it in his face, because you might lose that man's desire to be
First,
open
yeah, yeah, to be
if
open, yeah.
if
I think that's very important, actually.
if you've used it against him. That's one thing I would say. But secondly, there's a difference between an encouragement to, babe, take care of yourself and this and that, and mothering somebody. So as a man, I have a mother. I don't need another. I mean, this is a longer conversation than we
Yeah,
can
definitely. It's
we can
something that
actually
we
do.
can't get away from, really.
Yeah, exactly. So another comment from YouTube. How about if blood donation centers include BP checks or basic health assessments too? Many men don't go to their GPs. What do you think about that, Dr. Femi? Looking at other places where men are to target health outside of GP surgeries.
Yeah, yeah, I think such opportunities abound, actually. Even with pharmaceuticals, if you go to any pharmacy, most likely they'll be able to check blood pressure, your BMI. Some can even do your blood sugar and things like that for you in pharmacy, and it's just a walk-in. Yeah, just a walk-in service. So yeah, I know how difficult it can be to get an appointment with a GP. I've tried to get an appointment recently for my wife as well, and I just wondering what's going on here. So it can be very difficult even to get such appointment, but opportunities abound everywhere. Pharmacies do it. Yeah, I think I can only think of pharmacies, but and I think they are bound. They are everywhere. So you can get it done in the pharmacy.
So one of the people I'm connected with on LinkedIn, he's called Jesse. He is a barber, and he set
Oh,
up this thing in London called Thursday Night Jollof. Because again, we know. So let's let you into a little secret, ladies. Men do talk. We just don't talk when you're there. So he
football
created
matches. Someone tell us.
so he created a community of um what where it's a weekly thing where they share jollof rice in a barber shop, and they talk about mental health issues, and they're trying to reduce the stigma of talking about mental health. So there are lots of things happening all around. And I know, for instance, my church, we started a monthly men's meeting in Manchester. It's just important because I think it's one of those things about, ask, seek, knock. If you look for these things, then you'll find these things. But you're absolutely right in that it's sensible for us to go where the men are rather than ask the men to come where we are. One of the other comments is, how can we overcome the stigma that is preventing many men from seeking help early?
Yeah, well, that that um that's a sensitive thing, really. But I want to just say that, when we begin to look at the glaring statistics before us about the life expectancy, about certain kinds of cancer that are commoner in men and all that of Black origin, then I think that it's just a matter of a mental shift, really. To be honest, when I came to this UK, it was then I realized that these people don't really bother. They want to get checked. When I want to do a rectal for a patient, for instance, and I'm taking permission, and they don't bother. They just want to be sure that they don't have prostate cancer. That's
Yeah.
the only thing. And they also want to be sure that even if they have it, then it is picked up early enough.
Mm.
That's the only thing they are bothered about. So I think many times maybe a mental shift, understanding the fact that when you take care of your health, it's not just about yourself alone. It's
Mm.
about posterity. It's about your children. It's about your wife. It's about your family. It's about everybody that cares about you. When you take care of your mental health, of your physical health, then you're also taking care of the future of your children, of your family, of posterity. So I think
Yeah.
when we understand that, then we begin to have a mind shift and then change our perspectives as regards to seeking help early. I know that there may be a lot of stigma, like Dr. Ayo said. Now, when we go to where the men are, someone
Mm.
said something about where they watch football and things like that, where the men are more comfortable to discuss amongst themselves.
Yeah.
Sometimes you may not be able to talk because maybe someone is there or someone that looks up to you is there and all that. But in a safe space, if we can create safe spaces, if there's a place you find to be safe enough for you to talk, to let out this steam, then you go there and have a talk. But by and large, ultimately, it's very important to talk about these things. It's very important to seek help, and it's very important not to bottle things
Mm.
in.
I think
Yeah.
it's about normalizing the conversation, normalizing the openness, the vulnerability, the transparency. Again, I keep referencing Jason Wilson because I think he's doing a lot of good things in this space, not just from physical health, mental health. And one of the things that I heard him say, which was really profound, that I think speaks to this point, because a few people have talked about personal responsibility, taking care of yourself, and stigma. Now, he references the statistic that you mentioned before, Dr. Femi, that men in general, we die earlier than women, and our health-seeking behavior is slower than women. And he referenced the fact that so for a lot of men, when it starts as boys, we have conditioned boys and men to be performance driven. Everything in life, the measure to which I am of value to society is by what I do. So, and the problem with that is that I am a human being, not a human doing, And so if I am conditioned to believe that all my life is about suffering and working hard and stuff, that obviously will drive me to achieve a lot of things. But one of the points he made is that why would I seek help if it's just to stay alive longer, just to be a slave, just to work, And from a mentality point of view, I think it's important for men to start to divorce themselves from what they do and get to the point where I realize that I am valuable because of who I am. I am valuable as a human person. I am valued as a human being, irrespective of what I bring to the table. And therefore, taking care of myself is important. Somebody's made the point here that taking care of everybody else in my life starts with taking care of myself. You can't give out of an empty cup. We know all of these things, but maybe the it's disincentivizing because I only see myself as a checkbook for other people. I only see myself as a provider for somebody else. I only see myself as a shoulder for somebody else to cry on. But again, I am a human being, not a human doing. We've got some other questions. Is there anything we can set up within our community to ensure that we are filling the gaps, be it mental or physical health? I note that the health checks tend to be aimed at people over 45, yet statistics show that men below this age are also at risk of cancers and mental health problems and suicide. So what can we do?
Yeah, I think I'll leave that aspect of setting up things within our community to those that are in charge, so to say. But yeah, the NHS has something called 40 and above health check that we can take advantage of. If you've not done it, you can request to see to yeah, it's your right, so to say. So you can tell your GP and get it and get across your GP and get it done. And you're above 40. Usually for those that are 40 and above, you should get a message from your
Yeah,
GP asking you to come for some checks. Now, as regards certain kinds of cancers that are commoner, I spoke about a 20-something-year-old colleague that we lost to colon cancer. So it's possible it happens in certain younger age groups, but the paramount thing is not to ignore the red flags, the
mm,
warning signs that may be there. Now, many of the health checks and the routine checks that are available in the UK have been done based on research, and this is over the years. Now, okay, this is the age group where this is likely to be more common. But then we mentioned something about family history as well. We've got
mm,
a family history of breast cancer, a family history of colon cancer, and things like that. Then maybe younger at a younger age you need to be checked. But generally, 40 and above health check is something that is recognized in the NHS. And you
yeah,
can have all your routine bloods done, blood pressure, BMI, and all whatnot. So you can have all that done routinely under the NHS. But
yeah,
importantly, if you notice any red flag symptoms,
yeah,
whatever age it is, get it checked. I've sent
yeah.
people for colon cancer screening because we're bleeding from the back passage, and they just
Mhm.
feel fulfill the guidelines at a very young age, maybe 30 something, and so things like that. There's something that happened in the UK recently called Jess rule. That if you go to the GP for more than is it 6 times or yeah, a certain number of times, they need to escalate it because of the lady after whom that was named. She died of, I think, lung cancer during COVID. She went to the GP several times. But of
Mm,
course, it was usually on because of COVID, the encumbrances of COVID, telephone consultations, and just kept giving medications for certain things until it was discovered that she had end-stage lung cancer. And
mm.
eventually she died. So don't ignore symptoms. That's just the warning
Absolutely.
thing. Yeah.
Absolutely. And I think again, one of the things I love about the Black Health Hour is an encouragement for us to take responsibility for ourselves. There's so for everybody who's listening, watching this, please, you are in your community. So I would strongly encourage you to send this link to a brother, send this link to an uncle, to a father, to a nephew, to a son. Let them listen to it. Let them send it to their own friends because we have to take better care of ourselves. And also, there are reputable sources, the NHS website, and all these kinds of stuff where you can find out. Dr. Femi talks about red flags. What are the red flags? For somebody my age, for somebody from where I'm coming from, there's so much information and one of the things I always say is to be informed is to be armed. Now, let's identify the elephant in the room. Maybe you're scared. Maybe you don't want to know. But as a doctor, I would say to you, knowing is always better than not knowing, because at least you know, then there's something that we can do about it. But how many people have you seen, and I've seen, Dr. Femi, where the problem is harder to deal with and maybe impossible to deal with because somebody presented late. So please don't ignore. Please engage. Please have those conversations. Please let's normalize all of these things in society because we want to make sure that we are taking better care of ourselves. So before we go, Dr. Femi, if this is a man listening, what's the one, if there was one message you could say to somebody who's listening, what would be the last thing that you would want to leave them with?
I think I'm just summarize everything with what you just said. Take responsibility.
Mm.
Take responsibility. And once when you take care of your health, you are not just taking care of yourself. You are taking care of the ones you love and the ones that love you as well. So I think from that point of view, you will take more action. You'll be more proactive with respect to taking charge of your health, whether physical or mental health. Thank you very much. I think it's been
Thank
a
you so
pleasure
much.
being here. Thank you for having me.
Wonderful. Dr. Femi, this has been a
Yeah.
pleasure. Thank you so much for your time and your expertise and your passion and your knowledge. Thank you for sharing that with us. Thank you, Lord. Thank you, Dr. Femi. We need more people like you coming to talk to us on the Khan Health Hour. I want to thank everybody for joining. It's been a wonderful time, and like I said, when this is over, go to YouTube, go to LinkedIn, go to Facebook, and share this link. It's really, really important for us to normalize this conversation. I've been your host today, Dr. Ayo. It's been a pleasure, and I'm going to hand over to Yusuf to close the session.
Maybe our colleague Yusuf is having a technical issue. Is Yusuf, are you here? It was a great session. I've learned loads. I know I'm not the target audience, but I learned so much. Particularly this thing about help and listening to the early signs. Thank you as well, Dr. Hayo, for the message around women not being mothers. I think that's very important as well. Women already carry their own burdens, and we just need to empower men really to do what they can. What I think I'm going to do is I'm going to just do the closing myself. And I hope next time we'll be able to see our colleague. He was so ready to go, but sometimes we have technical issues. So here am I sharing my screen, hopefully full screen. I wanted to also thank Dr. Femi. It was wonderful to have you. You have such a welcoming, humble tone, and I think that makes it very empathetic and accessible to people. And the same goes for Dr. Hayo, always showing that doctors are just like everybody else and have the same experiences as us. It was really empowering, and we don't do enough men's health session. So thank you for your time. Thank you for volunteering the time. We just simply couldn't do this without our volunteer doctors. I wanted to share the next week, as you can see on the screen, we have another session on men's mental health because it's not enough. As you've seen, there was loads of questions still. There's loads of things that still need to be discussed. So we want to continue to create that space. People said in the group that the biggest barrier to dealing with mental health and accessing help was things around stigma and things around as well safe spaces. So we're really looking forward to be able to discuss that next week with Dr. Joe. Dr. Joe is an absolute star and advocate of Khan. He does really great work, and I look forward to see him there. If you know men in your family, do invite them along. It's an unmissable session. In next week, next Saturday, we have the Manchester Health Festival. We are doing an event with MANSAG, the Medical Association of Nigerian Medical Association of Nigerian across Great Britain. Is a very known group, very active of doctors, but this is not just for Nigerian doctors. There'll be health professionals of other backgrounds, but this collaboration is with them. Come and join us. There'll be conversations around health, but also around health, recruitment of health professionals, about how to get in the profession as well. So loads of networking, loads of music. As always, it will be a great event. Do register, drop the link on the chat, and there is also a QR code on the screen. We are currently trying to do a focus group for anyone of Black and Pakistani as well community around leukemia, lymphoma, blood cancer. We've been finding it very, very, very challenging to get to this group of people. So I just wanted to leave a very personal appeal here, well, personal from Khan, to engage with this. There's not enough conversation about this blood diseases that you can see on the screen. I know it's very specific. Therefore, if you know anyone, please share the email of our research team, research@khan.org.uk, or the phone number. There is also a £50 thank you for people participating. We know that doesn't even do a dent, but it's just to say thank you for participating, to sharing your experience with us. It's a really short focus group, 75 minutes, but it's just, yeah, I can't explain how important it is to get involved. There is not enough people talking about it. We know it's very niche. So here I leave the appeal. Very recently, we have published the fibroids report called Breaking the Silence. It's time for change. This is published by the APPG on Black Health, so the all-party parliamentary group on Black Health. I don't know if you know, but it's been more than a year now, I'll say about a year, that Khan as the secretariat for the APPG on Black Health. It's very important that we are on the spaces where policy is made, influencing policy, creating these conversations, because yes, we empower and advocate for people to do changes within themselves and their habits, how they engage with health, but we're very much aware that there's systematic changes that need to be done. So if you're interested, please do access our fibroids report, and we want to hear from you. Also appg@can.org.uk.co.uk. We have a ladies workshop. It's going quite well. We have a few people enrolled, but there is space for more. It's a free workshop. Ladies workshop is about 12 weeks, just empowering women through healing, growth, community, being together. Is with our wonderful colleague Peace. So do join in if you're interested. QR code is on the screen as well as the email. And Khan has loads to offer all over the country, up and down. We have the Enfield Black Community Forum in London. The Black Community Forum is a space to speak about health, engage with your neighborhood, with local services. I know that it's thriving, and our colleague Stephanie is doing a great job down in London. Email her, scan the QR code. We'd love to hear from you. If you are from Enfield, come and spend some time with us. And last but not least, BHIP, also in Enfield, making healthcare more inclusive and effective for everyone. BHIP is like important. I would say is one of the jewels of Khan. Is basically a training that intends to, is a cultural training that is looking after, that is targeting primary care professionals, so pharmacists, GPs, dental surgeries, to try to better support them to become more inclusive, more culturally aware, know what vocabulary to use, how to be aware of some cultural cues that people from our community, particularly Black, Caribbean, and African, give when they're accessing care, particularly primary care. So this is incredible, and it's free. This training, it's free. So if you are in Enfield and you are a doctor, you're a pharmacist, you are a leader within your community, email us and we can direct you on how to engage with BHIP. Thank you. I know there was a lot to share, even for closing, but we just want to say thank you for being here today. Thank you for staying with us. Thank you for engaging with health and just making space for your own health and the health of your loved ones. And we hope to see you next week. Thank you. Bye-bye.
Whether you joined us on Zoom, Facebook, LinkedIn, or YouTube, thank you for making the Health Hour part of your Saturday. We hope today's session gave you the right dose of health wisdom that you can share with your friends and family. When we share knowledge, we strengthen our entire community. Mark your calendar. Next Saturday, same time. Got a topic in mind? We want to hear from you at health@can.org.uk. Health Hour, hosted by the Caribbean and African Health Network.